name is Dr. Blaze Bear. Today I'll be speaking with you about leveraging technology in healthcare to improve margin. So, reasons to say you can't open an industry publication today without reading how technology is improving the healthcare system. The walls of paper records that used to dominate physicians' offices are giving way to cloud-based electronic health records. The bring your own device movement has empowered caregivers to use medical apps on their phones and tablets in the workplace. 3D printers are creating models for surgical planning and even making custom implants. Robots are assisting surgeons and physical therapists, and gene mapping is opening new horizons for individualized care. Health systems should consider identifying strategies to enhance revenue, to reduce costs, and generally improve efficiency. New approaches, such as using predictive analytics and artificial intelligence to improve the supply chain, or robots and cognitive automation to enhance finance and revenue processes, have the potential to bend the cost curve and boost revenue in the coming years. Today in this webinar, we're going to discuss exploring different digital options. We're going to discuss adapting to a new normal, and we're going to be identifying the margin improvement once we implement the new technological changes. So you're wondering, how can technology add value? Modern technology can help add value both in the hospital and across care settings, helping providers improve performance and reduce variability. There are four elements in work. They really work together in post-acute care, and this can be applied across the board in healthcare. The first of which is data and analytics. These yield information about each patient's medical conditions and personalized needs. Big data can play an important role in healthcare, particularly if we bring it down to the level of individual patient care and input good quality data. Data from health risk assessments, data from insurance company profiles, and even wearable trackers or smartphone apps can all be leveraged. Clinical protocols can be used to establish best practices to create a plan of care and minimize variability. The trick is to deliver relevant, personalized, and timely guidance to clinicians while avoiding alert fatigue. Alert fatigue causes doctors and nurses to rather tune out support tools. This means developing an understanding of clinician workflows, preferences, and incentives is crucial to leveraging technology to increase the margin. User experiences, assessments, and workflow management, these all help doctors and nurses to be more efficient and effective and to keep technology from getting in the way. Electronic health records, these are an important step to help modernize healthcare. They work well in the hospital setting, but as far as home health is concerned, whereas the patient will try to access their information from the house, it's not very effective. So because of that, we really need to work on integrating information. Integration enables administrative and clinical information to be leveraged across care settings to manage system-wide performance and to generate new insights. A dashboard can provide a clinical leader with information they need to identify best practices, to pinpoint outliers, and to plan for the future. So really, we really need to be focused on optimizing technology to increase the revenue. For example, between 2014 and 2024, the healthcare sector is expected to undergo the fastest employment growth among all industries, according to the U.S. Bureau of Labor and Statistics. By 2025, estimates indicate that more than 3 million nurses might be needed to care for the population. However, the national supply of nurses is only projected to reach 2.8 million by 2025. This is going to leave a gap of about 250,000 nurses. The shortfall between supply and demand is expected to drive additional wage increases. The Hospital Corporation of America saw a 36% increase, around $55 million, in contract labor costs between the third quarter of 2014 and the third quarter of 2015. The primary reasons for this increase were higher patient volume due to the ACA insurance expansion and the nation's improving economy. However, the HCA applies real-time analytics to manage its workforce, reportedly checking labor statistics every 2 hours and staffing its workforce based on acuity and productivity targets. In addition, the HCA uses a dashboard enabled by predictive analytics to look at projections and a historical patient figure. And this really does help them to accurately identify the staffing needs. while contract labor costs increased by almost a third between 2014 and 2015. The HCA was able to keep its labor ratio, which is the total labor cost over the net operating revenue, in check. It only increased from 45.8% to 46.9% during that time. The HCA's use of technology and the most appropriate employees to leverage that technology. This may be a useful lesson for hospitals in general, at least hospitals that wish to rein in labor contract costs. Organizations should work to optimize internal revenue services and processes by using predictive and responsive platforms that are effective, efficient, automated, and which move in real time. RPA is just one of many exponential technologies that can aid healthcare organizations. After successfully incorporating RPA into their core business strategies, hospitals should consider moving further along the cognitive computing spectrum, all the way into AI and machine learning. Unlike RPA, machine learning technologies can help identify patterns in data. When we apply this in healthcare organizations, really machine learning can help to identify patient payment variants and really can remediate complex payment methodologies. So beyond collecting data and performing evaluations, patients now have access to some of the best diagnostic tools, new and cutting-edge treatments, and a myriad of minimally invasive procedures, resulting in less pain and quicker healing. We can say the same about healthcare workers. With the help of technology, health staff have a more secure and quick system in place. Technology helps beyond collecting data and performing evaluations. In cybersecurity, there are significant benefits for care, delivery, and organizational efficiency, from the expanded use of network technology, internet-enabled medical devices, and electronic databases for clinical, financial, and administrative operations. Network technology and greater connectivity also increase exposure to possible cybersecurity threats, and these require hospitals to evaluate and manage new risks in the context of federal privacy rules, as well as related policies. Hospitals can prepare and manage these risks by viewing cybersecurity not as a novel issue, but rather by making it part of the hospital's existing governance, risk management, and business continuity framework. Interoperability is the next point I want to touch on. And really, this just includes the exchange and use of information, both within a singular healthcare organization as well as across multiple organizations. Barriers to interoperability must be addressed in order to support the level of electronic sharing of health information that we need to provide the best care, that we need to engage people in their health, and that we need to succeed in new models of care, as well as by improving public health. Doing so requires collaboration across many private and public sectors. This includes hospitals, this includes health systems, technology companies, the payer, the consumer, as well as the federal and state governments. And the last part I just wanted to touch on here. So beyond collecting data and performing evaluations, we come across telehealth. Telehealth really has emerged within the last couple of years and really has been propelled to the forefront by the COVID pandemic. From emergency department care to remote patient monitoring for chronic care. We can even give access to specialists. Telehealth is changing the way healthcare is provided, both by expanding patient access to routine and specialty cares, like I just mentioned. And we can also, this leads to improved patient satisfaction and outcomes. Recent years have been really significant, and we've seen lots of growth in telehealth to the point where more than half of US hospitals can connect with patients and consulting practitioners through the use of video and other technologies. Really, this is all coming pretty fast. We do need to face our fears. Some physicians, some clinical workers, some nurses can be afraid that maybe robots will take over their jobs. The fear of the unknown place called the future and what it might bring upon us is common among many people. Getting used to one system and how things used to work and then suddenly bringing in new systems that require training, that's a task. Our task at the moment is to face our fears about the future. We need to face them with courage, to turn to technologies with an open mind, and to prepare for the changing world with as much knowledge as possible. As a healthcare administrator, you may want to assemble a meeting for each department to talk about the new health system. as well as its benefits. Nevertheless, to be ready to answer questions and manage frustrations, a healthcare administrator must be willing to really to assign trainings and to educate them on the new way of thinking and the new things we're going to be doing. Health tech has the potential to trim the fat from our traditional healthcare scene, skyrocketing costs, unbearable wait times, inefficiencies in drug development. All of these things have got to be improved, and telehealth tech is really helping with that. Even things such as limited access to health insurance can be improved. Yet these advantages come with new challenges. Hospitals and other healthcare organizations must continuously check for updates and avoid new types of medical malpractice suits. They'll also need to consider how business practices and patient care intersect. Hospital and health system trainings and development programs become increasingly important when new software is put into place. Such trainings can help retain current employees, it can help improve their skills, and it can positively impact the overall quality of a health system. However, training and development initiatives aren't often a top concern for a system's health leaders. This, of course, is not surprising given that leaders are faced with more pressing issues such as reimbursement, such as compliance, clinical quality, and other issues that we can't even list here because we don't have enough time to go through that. However, training and development of the employees is an important area that these leaders do need to assess and assess often because things are always changing. Technology is moving very swiftly, and we really do need to catch up. And once we catch up, we need to catch up again and again and again. It's not going to stop anytime soon. So what are the best practices for healthcare facility training programs? There's some points that you need to kind of hone in on. So the healthcare system offers thousands of training courses each year. These are both mandatory, such as those for compliance, for privacy, for clinical skill development. They can also be optional. So an example of an optional training would be a continuing medical education or a leadership development opportunity that an employee decides to take. Overseeing thousands of trainings each year can be a daunting task. However, there are a few best practices that can help ensure any given training program meets its goals without overextending a health system's resources. So the first thing is we can create training programs for different learning styles. Each employee might have their own learning style. So training programs should include material that appeals to various learning styles, whether it be verbal, visual, hands-on, or whatever else the employee might appreciate. We also need to make the programs interactive. So this means group work, quizzes, and other activities that can help make training programs less lecture-based and more interactive. That's a positive thing. Something that is not only going to help them retain the information, but also makes the training more enjoyable for the employee. We need to embrace computer-based learning modules. While certain types of trainings may be better suited for face-to-face training, things like CPR, that's neither here nor there, but many others can be completed online. Computer-based training modules are often more convenient for employees as they can be completed from various locations at different paces, at different times. All of these things that can work better with the employee's schedule. We need to personalize the information so that it's specific to your own your own hospital or health system. So if you're using a third-party module, you need to select one that really will allow for some personalization to be specific to your health system. We need to ensure that training reflects the changing skills. Hospital training programs have always covered issues such as compliance and clinical competency, but increasingly hospitals are developing programs around newly sought after skills such as customer service and patient-based care. We need to consider the employee demands beyond training. So employees at a hospital have multiple responsibilities that they're already performing. And the training really should be designed so that it can be completed without taking away from these responsibilities. And finally, we really do need to evaluate the effectiveness of training programs. So we need the hospitals to always assess the effectiveness of the training program through surveys or through direct testing of skills. After all, a training program that doesn't effectively improve some skill or some competency really is a waste of the time of both the healthcare system, the hospital, and the employee's time. If it doesn't work, we're not going to be wanting to do that. We need to be efficient. That's the entire point of this. And really, This leads into one of my final points is how are we going to increase the profit margin? So many healthcare providers have aging back office technology platforms, which are really unable to support business needs in an increasingly complex and evolving market. Finance is one area in need of transformation. Digital solutions can elevate the current capabilities to next generation levels. The supply chain is another operational area that can benefit from digital solutions. With a set of dynamic networks around a digital core, the supply chain of the future, it's going to be shorter, it's going to be faster, and it's going to be more responsive. It's also going to be smarter. Accurate and timely clinical documentation is a very important element of a healthcare provider's revenue strategy. By leveraging new technologies, organizations can improve care documentation, they can reduce administrative burdens, and they can enhance revenue. For example, natural language processing can be enlisted to prompt set for more refined documentation if you feel you need that. Organizations could also employ automatic coding techniques using document keywords and leverage technology to automatically generate documentation-based appeal letters. Patients frequently interact with the revenue cycle system, often for longer periods than they interact with the clinical staff. As such, making scheduling, registration, and billing processes consumer-friendly really is just as critical as producing quality outcomes. Strategies that can help hospitals improve their patient experience scores and avoid collection issues that have historically plagued the revenue cycle. We can really fix those. We can leverage the technology to overcome the historic failures of the past. We can give patients upfront and clear cost estimates for their care. We can help patients navigate basic health insurance terms. For example, some patients might not know the difference between a copay and a co-insurance. We can help them with that. We can deliver timely, easy to understand documentation, easy to understand statements using the patient's preferred delivery method. For example, patients who don't have internet access might prefer to receive bills in the mail. Lots of patients, especially the aging population, they do struggle with technology. So we need to be willing to accommodate their needs. And lastly, I just wanted to hone in on one thing. So why do we share information? What are the benefits of sharing data? Achieving the reality of a fully interoperable health information, it offers many benefits, such as we can strengthen care coordination. The providers, the patients, and caregivers, we can all work together to make a fully formed healthcare decision. We can improve the safety and quality of outcomes. With interoperable patient data, it translate better into a safer and more efficient experience. We can empower patients and their families. People can make better informed clinical decisions and can become partners in their own care. Increase efficiency and reduce costs. The information sharing that we will be performing reduces costs for both time and resources for patients, insurers, clinical and administrative staff. Everyone's going to benefit from this. We need robust public health registries. So the sharing of aggregated health information supports more accurate tracking and prevention of efforts for disease and other public health threats. And again, we're going to hone in on COVID. This is going to hopefully increase the likelihood that we're going to catch something like this before it even happens, because we cannot repeat what we just did. And that really wraps everything up. I just wanted to give a quick summary real quick. So really, what was this webinar about? In this webinar, we learned that healthcare technology refers to any IT tool or software which is designed to boost hospital and administrative productivity, which gives new insights into medicines, into treatments, or which improves the overall quality of care for the patient. Today's healthcare industry is a $2 trillion behemoth at a crossroads, currently being weighed down by crushing costs and red tape. The industry is looking for ways to improve in nearly every imaginable area. That's where health tech comes in. Tech-infused tools are being integrated into every step of our healthcare experience to counteract two key trouble spots: quality and efficiency. Healthcare technology companies have provided a much-needed jolt of efficiency by tailoring experiences to the individual. These companies realize there is no one-size-fits-all approach to proper care. Customization is key. It is very crucial. By personalizing everything from insurance payments to diets to sleep patterns. Health tech companies, sorry, I keep saying health tech companies are amplifying human health and reducing much of the unnecessary strain which currently plagues the industry. And that's it, guys. So I really hope you found this webinar very informative, very helpful. I hope now we know how healthcare can use technology. We can leverage technology to increase the margin and to improve patient care and efficiency in the clinical setting. We can connect with AIES on social media, visit us on LinkedIn, visit us on Facebook, and we're here for you guys. So I hope everyone has a great rest of their day, and I hope you really enjoy this webinar. Thank you.